Hey guys, I'm Doug.
I'm Dr. Chris Frueh. I'm a clinical psychologist.
Dr. Frueh wrote the paper on operator syndrome, which is?
Well, operator syndrome is a framework for understanding the kinds of complex medical and behavioral problems that military special operators have.
It's been exacerbated in this group. We see it the most because of the most exposures.
Well, you can take the framework and apply it to first responders, firefighters, EMT, and maybe all of us from a holistic perspective. But what you see in special operators is a level of magnitude of blast wave exposures, chemical exposures, chronic stress. The op-tempo that you guys have spent working with for the last 20 years. So it's kind of that whole great big ball of wax, and it all kind of melts together like a ball of wax will. So if you have a blast wave exposures that cause TBI, it's going to affect your sleep, insomnia, sleep apnea. Not oxygenating your brain is going to lead to depression, to effects on your endocrine system, low testosterone, and other endocrine variables.
So, and your background is in psychology, right? You're a psychologist?
Clinical psychologist. I spent 15 years in the VA.
Okay.
And I escaped about 15 years ago and have continued to try to do some work with the veteran community and the active duty community.
I think it's interesting that what we talked about that kind of got us in here, and you just came in from Hawaii, so a moderate amount of jet lag. I managed to rope you in, but we were talking about.
You're very persuasive.
Forceful. I don't take no for an answer. I was like, quick, come fast before your wife knows you're here.
You saw the no that was appearing on my
I did.
My face.
You were like,
2 seconds.
I was like, come on, quick, just a little bit. But we talked about you're like, what do you want me to talk about? I was like, well, I'd really like to talk about mental health as a whole. And I think that you said something that really, I was like, that's what I want to talk about, which is you said that in all your time at different psychiatric institutions, you never really saw anybody make a direct link between endocrine dysfunction and mental health issues. And I know that within the special operations community, we have guys that are manifesting, like we said, domestic abuse, alcoholism, sleep issues, just anger.
Marital problems that don't involve violence.
Forgetfulness. When you just look at things like chronic ADHD symptoms, it's really difficult to be in a relationship with somebody that forgets everything all the time.
Right.
It seems like it's on purpose, even if it's not intentionally on purpose.
Right.
So I'm interested in that as a phenomenon, mostly because I don't know where the gap between endocrinology and psychology is or how we bridge that, but it seems as though you're starting to have that conversation.
Yeah. Well, so, we do too much in healthcare in this country of specialties. So you have a psychiatrist, you have an orthopedic surgeon, you've got an oncologist, you've got somebody that focuses on endocrine, and there's not a lot of communication or connecting of the dots. My own 30 years in the profession of mental health care, my own biggest criticism of the field is we do not do enough with the endocrine system. We should be screening everybody at the point you walk in the door to a therapist, you either have labs with you or they say go get some blood labs done. That should be routine screening right off the bat. Because if you have low testosterone, which by the way is a clinically actionable target, and you get a prescription of Zoloft, Prozac, or whatever, and I'm doing therapy with you, we're not hitting the right target.
Well, the Zoloft isn't actually boosting testosterone, even if it's...
That's my point. Yeah, that's exactly my point, is you're getting a bunch of medicine, you're getting a bunch of therapy, and you're getting a bunch of stuff that you may not need at all. You're not getting what you do need.
Yeah, I was in therapy with a crumbling marriage in 2014. I was drinking too much, I got DUI, and I thought my career and generally everything was over. I went into the doctor because I was literally looking for anything I could do to convince my wife to stay in some capacity. Mm-hmm. And I asked for a testosterone level check because I was like, you know what? I think I'll feel better on this thing and I'll get big, right? And I was like, I'm going to get strong. And I didn't think that my numbers would actually be low. And because I asked for it, I was suffering all the symptoms of depression. I knew they were going to ask me if I was depressed. And I said, no, not at all. I just feel lethargic.
Let's put this into this conversation right now. If for a man with low testosterone, you can expect to see depression, irritability, poor sleep, poor interpersonal relationships, low motivation, low strength and stamina to work out, irritability, and low sex drive.
Yep. Well, so it was odd because it was kind of asymptomatic for me in a variety of ways. Like, I wasn't fat, I didn't have sexual dysfunction, but I was irritable. Yeah, agreed. Well,
give that a few more years of that, and you might.
My testosterone numbers were double digits, and it was very, very low. I mean, much lower than I expected. So low that my general practitioner was immediately like, "We're going to put you on Testosterone right off the bat." And I was like, I didn't want to actually need it, And then I asked for a referral to an endocrinologist, and it was funny because my GP, who was willing to give me testosterone to address what was clearly a low issue, the endocrinologist was equally uninterested in figuring out what caused
what was the root,
the low hormone. I mean, so going into this office where a specialist was going to tell me, like, we'll figure out what's causing it, didn't happen.
And that is the fragmentation of healthcare, because your specialist is probably thinking, well, that's not my problem. I'll fix the low T.
Yep.
Somebody else does everything else. It's like when somebody I know died a week after a surgery. He was a Navy SEAL, died of a blood clot. But the surgery was successful from the surgeon's perspective.
We left the oil drain plug out. The oil change was successful, but then the engine blew up.
But not his fault, right?
Yeah, exactly.
Exactly. Yeah. So what I do, and I've worked with, kind of from a coach or psychological perspective, probably several hundred special operation warriors. And the first thing I do is, have you had your blood tested recently? Have you had a sleep lab in the last 2 or 3 years? If they haven't, it's like, boom, those are at the top of the list. Yeah, I'll talk with you about your depression. I'll talk with you about your relationship problems, and we can do some small stuff. But until we get to the point of the sleep labs and the blood labs, we're just kind of goofing around until we have those things understood. And maybe many people come into a psychology appointment without testosterone or without endocrine problems.
They just know there's a problem.
But you got to get that looked at. You got to rule it out, if nothing else.
Well, and this is, it affects females equally in different
ways.
Yeah.
Exactly.
It's interesting because I was lucky enough to be friends with Jeff Dardia. And when I brought it up to Jeff that this was a problem, Jeff was literally like, man, I was wondering when you were going to ask me about that. He's like, I've been watching the wheels fall off for like a year. I was wondering if you were going to actually address it. So he, of course, was plugged in with Task Force Dagger. They paid for me to go to Cleveland Clinic. And that was another whole eye-opening experience just with all the labs that happened there.
Because they looked at everything, right?
And I sat down with the DO and he talked to me about everything holistically. We did an hour and a half, consult. And then we did follow-ups based on my lab results and stuff. But I had vitamin D deficiency for 3 or 4 years. And the docs had just told me to take more vitamin D supplementation, but my levels never went up. And then no one had ever tested my lead or any other heavy metals, and my lead levels were through the roof. So as soon as we I changed the way I handled guns, the way I took care of cleaning my clothes and things like that. Lead levels came down. All of a sudden, vitamin D comes up, and I don't really know.
These things are all interrelated, I think is the
absolutely.
Yeah.
The question, I guess, is since we know better and we know how to ask questions or how to lean into our primary care providers to ask the right questions and kind of convince them that, the thread we're pulling is worth them pulling with us. How do we get people who don't have that knowledge or people who are just watching this video to ask the right questions of their primary care providers? Is there a way to go about it better?
It's a hard one. It's really hard. I like what Jeff talked about of bringing your spouse with you. Bring a second party there, even if you're not married. Bring a friend, because spouses and friends can ask questions that maybe are hard for us to ask of our care provider. So many of us are afraid of offending our doctor or rubbing our doctors the wrong way.
Don't want to get fired from my doctor.
That's right. And you don't want your doctor getting thinking ill of you, because then you might not get the care you need. The best programs for operators, and I think of like I just won't name any of the programs right now, other than the program that I'm part of, which is at Houston Methodist Hospital. But we're not unique. There's a lot of other programs like this. And the idea is to do everything kind of 360 with one team that sits down at the table together. So you've got the neurologist, the psychologist, the psychiatrist, the nurse, the social worker, the endocrinologist, maybe an orthopedic specialist.
And they're all looking at like a packet, or?
Well, they're all there. They've all done their evaluations within a week.
Okay.
Within a week's time, and then they all get together and talk. And so you are not telling me the same things that you've already told the 5 other people. And I'm not just doing my little thing and then going, well, I fixed my part. Everybody else does theirs. No, it's getting everybody together. I'm just give an example. A good friend of mine a few years ago, he's describing, for several months, all these difficulties he's having. And I kept telling him, it sounds like low testosterone. It sounds like low testosterone. It sounds like low testosterone. He finally went and got tested. And he calls me back and says, no, doctor says I'm fine. Levels are within normal limits.
How fine?
How fine, right. Get the numbers. Get the exact numbers.
I asked that guys hit me up, because I preach the same thing, and then guys are like, well, they were normal. What were they?
Yeah,
and what is normal?
Where are they setting the thresholds? Because different doctors, different healthcare systems set the thresholds differently. So in his case, his doc was setting the threshold at 240, which I would say is way too, that's not, I would set it at 300 or something. That's what I've seen. He had 242. He was 2 points over 240, and his doc sends him home telling him he's normal. And this is a 38-year-old man.
With the relation between like estrogen production and testosterone, very rarely do I hear doctors, they don't even look at non-male hormone function either. So you could be...
They need to do the full battery.
Yep.
Yeah. And actually, I've had surgeons from the VA system reach out to me in the last year to say thank you for writing that paper, because they're seeing a surge of surgeries. That has a funny sound to it. They're doing a lot more surgeries now on men who have developed large breasts.
For gynecomastia?
Yeah. And they're doing these surgeries without the community really understanding why there's so many of them. And imagine going into your doctor. I mean, you're an alpha male. You go in and, hey, guess what? You got big bitch
boobs.
Tits.
Yeah. I can say that. Yeah. You're not.
I said big boobs.
You.
You can call them bitch tits.
Yeah. I get my testosterone checked quarterly now, quarterly. And
good for you.
This time around when I went in, my doctor was like, hey, we're tracking your numbers are pretty normal. And I said, yeah, I have questions, because even though we've homed in on a place where I feel good for my total testosterone, my free test has climbed like super high. Like I'm way above normal, probably 3 times above the max normal range for free test. And like, I don't really know what that means. But I would love to check my estradiol and my estrogen numbers to see if those are also way through the roof, because if I am out of cycle on my testosterone doses, sometimes I'll irrationally cry during movies. I'm like, I don't know what's happening. It's like I don't have sensitive nipples or anything like that, but I mean, I feel like maybe there's something else going on, or maybe I've reached a place where my rest and exercise and diet warrant me coming off of exogenous testosterone if my free numbers are that high. And she was like, oh, okay, yeah, we can order those tests too. But the doctor didn't suggest that I take the test. She didn't look at my free test and think, we should look at other tests.
Yeah. No, usually, and it turns out doing a lot of these labs is kind of expensive. So a lot of the systems, a lot of the healthcare systems just don't want to do them. And also, many of these systems don't want to supplement testosterone. So there's a real resistance to it.
T is a dirty word.
It is.
Yeah.
It is. Because as you said, it's all about just guys wanting to get jacked, and it's not for other
want to abuse it. But also, it's worth noting, I mean, for the video's sake, you already know this, but when I first started taking the doses of testosterone the doctor told me to take, my testosterone numbers went crazy. they went high and then they kind of dropped, and then
Kind of like this.
yeah, all over the place. And I started reducing the dose and like shortening the frequency. I went from like every 14 days to every 10 days to every 7 days, but reducing the doses that I was taking, not by equal amounts. Like I take far less. I think 0.3 milliliters, like it's like what, 50 or 60 milligrams every 7 days. Tiny doses, but my testosterone numbers are actually higher now than they were on bigger doses. So a lot of guys get the stuff and they're like, what do bodybuilders take?
Yeah.
And they want to take that much. And I think that the endocrine system is weird.
Yeah, it's complicated. It's super complicated. And I think of, those instrument panels like that they use on sound systems that have all those little levers that you could slide up and down. That's my analogy for our endocrine system, that you need to have an expert. I'm not an expert for sure, but you need an expert who can look at all the numbers together and go, yeah, this one needs to be a little low over here. We want to pull this one up here, sound mixer.
Okay.
The
And
analogy of a sound mixer.
how do I find a panel of the appropriate experts like Houston Methodist program? If, for instance,
There aren't those programs.
Really?
You've got the Cleveland Clinic, you've got...
what would you say to someone who was currently dealing with, what we refer to as a shit show in their life, like a bunch of problems that feel like they're out of their control, and
They're howling at the moon.
Yeah, they're contributing to them, right? It's like I can't get out of my own way.
Yeah.
What would you say is the best forward approach for those guys?
Do something to help yourself sleep better. Because if you focus on sleep, who doesn't want to sleep better?
Yep.
Who doesn't want to wake up in the morning feeling good? I think that's most of us. So, and that's usually where I start. Because nobody wants to talk about depression or PTSD. But if you start talking about sleep and you start talking about what does it take to sleep well, we get into the endocrine stuff, we get into brain health, we get into diet and exercise and lifestyle stuff, all of that for sure. But then that's a nice lead into emotional problems, behavioral problems, relationship problems. What I often tell many folks is, just like what we just learned, only 4% of certain healthcare providers are veteran-centric.
They don't even know that they're dealing with a veteran.
Yeah, and even if they do, they don't know they ask the right questions. Like, where were you? When were you there? What were you exposed to? Just give me an overview of what life was like.
When did this problem start?
When did the problem start?
Yep.
Yeah. So all of that, and it's hard to find good providers and it's hard to find good systems of care. What I've started telling people to do is get the frickin' operator syndrome paper and take that to your doctor.
We'll include a link to the operator syndrome paper in the comments section so you guys can look through it and actually get a better idea of what's going on here.
It's also on my LinkedIn profile.
Okay.
Anybody can grab it and download it.
Hey, Dr. Frueh, thank you so much for coming in. I really appreciate it. I know you've been running ragged, but it means a lot to get you on here. You've been on my top 5 hit list for people I wanted to get on camera, so I appreciate you coming in and keeping me honest and giving some good information to the people that see the video.
Thank you for having me.
Awesome.